Hi everyone, welcome to my presentation on obesity among families with children experiencing low income in rural Maine. I'm going to be talking about the US obesity rates as well as the Maine obesity rates. I'll touch upon the determinants as well as some potential interventions. And this is really important because annually we're spending about $14 billion in direct health costs just for childhood obesity alone. And childhood obesity, if we're starting with children aged 2 to 5, it's about 13.9%, and that just grows as the population gets older. Right now, for adults aged 20 and over, the obesity rates are about 40% of the population. Some health risks associated with obesity include hypertension, impaired breathing, high cholesterol, high risk of type 2 diabetes, and elevated blood sugars. Some disparities when it comes to obesity, medical costs. So it costs about $1,400 more for obese patients than patients of normal weight. Obesity and obesity-related diseases are significantly higher among low-income populations compared to those of higher income. And there's also a negative correlation between the availability of healthy foods and obesity rates. Nearly 75% of grocery establishments in rural areas are convenience stores. Looking at Maine specifically, you can see this map of the Northeast. Maine and Pennsylvania have the highest rates in the area, ranking 30 to 34.9%. And when we take a look over to the graph on the right, you can see Maine, which is that darker gray, is at about 30.4% now, but back in 1990, it was just over 10%. When we focus in on Maine, we can see that poor nutrition and physical activity behaviors correlate with these obesity rates. 34% of adults eat less than one serving of fruit a day, and almost half don't meet the recommended physical activity goals. And with adolescents, the rates are higher. 36.7% do not consume at least one serving of fruit a day, and over 75% don't meet the recommended 60 minutes of physical activity daily. So, as I had mentioned, Maine has one of the highest obesity rates in New England. And this might be due to the high percentage of rural residents. Rural residents in rural states tend to have higher risk factors that are associated with obesity. So the socio-ecological model helps us to observe and understand these rates of obesity. And when we break it down, starting with the individual factors, this level includes things like annual income, education level, lifestyle factors. Rural areas have significantly higher rates of poverty compared to urban areas, and they have a tendency to display certain health behaviors that are associated with obesity that are directly influenced by their income. This is similarly seen with education level. Things like physical inactivity and poor diet, as well as the prevalence of obesity, are all seen to be increased as the level of education decreases. Social factors, behaviors that develop within the home can impact weight status. Things like eating meals as a family and serving vegetables, they all start to build those habits that are reflective of weight. And possibly the single most important influence of childhood obesity is the parental food consumption. Children are directly influenced by their parents, and it's been seen that when parents consume a healthy diet, they are less likely to have children that are obese. The physical environment can create a barrier as well. Within the physical environment, there could be limited spaces available for physical activity. There can also be availability and accessibility options in terms of access to healthy food, like fresh produce. Convenience stores are of high prevalence in these areas, and they primarily sell convenience foods and not fresh produce. So the prevalence of things like convenience stores and lack of access to places to conduct physical activity are associated with the poverty level of the community. So, independent of personal income, the overall poverty of the area will also affect things like medical care that's available. And then there's a policy level to this too. So local programs like farms, and then there's also federal programs like the Supplemental Nutrition Assistance Program, as well as healthcare. People who have Medicare have different options available to them in terms of access to receiving the proper care. So some interventions. The Healthy Families Intervention is a family-based community perspective, which is important because a child's health behaviors are largely influenced by their parents. And when children have either one or two parents that are overweight or obese, they're also at an increased risk of being overweight or obese themselves. So from a practicality standpoint, if parents and families have adopted these obesogenic behaviors, it's unlikely that a child trying to change their own personal health behavior will be successful. This particular intervention requires weekly visits for the parent and child where they complete 30 minutes of physical activity, they attend a nutrition lecture, and then they set goals for their upcoming week. So some benefits of this include the utilization of community partners to run the program. So that provides participants with not only an accessible location, but also they'll be able to trust the location because of the strong community ties. Participants also tend to receive benefits from these community partners, which include things like memberships, if it's to like a YMCA or something, as well as gift cards to grocery stores for healthy foods, which may have been financially out of reach for them otherwise. And despite utilizing a community partner for this program, accessibility still might be an issue in these rural areas because a third of residents living in rural areas have a commute that's over 30 minutes, at least one way. And this program has kind of difficult participation requirements. So some options are to adjust the schedule of the intervention, and that could be so that it occurs every other week, or that the program moves to being online and doesn't require an in-person presence. Similar to that is the Fit Family Challenge. This one's family-based as well, and the only difference is that families attend monthly meetings in person, and then weekly they communicate with the program, whether it be through email or text message to check in. It's based upon the 5210 message, and that is 5 servings of fruits and vegetables, 2 hours or less of screen time, an hour of physical activity, and no sugary drinks. So this program utilized the primary care office where children are already regularly seen and already familiar with this setting. It also maintains consistent communication to help improve retention. So they're talking on a weekly basis. But the biggest issue here is food insecurity and the accessibility to a primary care office. This is a population that experiences high rates of food insecurity. So in order to address this, we could possibly relocate to a location like a community food bank or community center, or have it in a location where SNAP or WIC employees are able to attend the meetings as well and provide benefits and an education in that kind of way. And then there's the school garden project. So this is based on the theory of planned behavior. The children are enrolled in school and they participate over a 12-week period. They create and tend to a garden in the school during school hours, and they explore plants in their science class and their literacy classes. And here the children are able to consume the fruits and vegetables that they grow. So this may be, the presence of fruits and vegetables in their diet that they might not have had access to at home. But the biggest barrier is climate in Maine. There's a limited growing season, and so we need to work around that, especially because the time that's available for growing is usually the time that children are not in school. So by providing a greenhouse or a tower garden, some other way to grow the vegetables and fruits that are independent of the climate. So in the US and in Maine, there are alarming rates of obesity that need to be addressed. And especially when it comes to families with children experiencing low income in rural Maine, it's very specific. So it must be addressed from a perspective that carefully takes food insecurity and accessibility into account. So I think the school garden project would probably be the most beneficial to implement. It provides education, it provides tools, it provides a source of healthy food options to children and families with minimal barriers. And there are my references. Thank you.